When I started my virtual clinic, I utilized several platforms to determine which would be most convenient for my patients. To name a few, I use Facebook, Google Meet, Viber, Zoom, as well as virtual clinic applications such as SiriusMD, Medify, and eConsults. And exploring this approach had its difficulties, from informing all my patients that I am only available for consult virtually and convincing them that these are viable solutions, up to guiding them on how to use this platform step by step. These, though, are commensurate to its successes. Once I had the processes in place, the patients eventually realized that it is easy and user friendly, making their online experience feel as genuine as a face to face consultation. And acknowledging the necessity to adapt, I expanded the focus of my Facebook page, aptly called Kidney MD, from primarily sharing health information on pediatrics and kidney diseases to becoming a portal where my patients could contact me for any concerns or questions. I posted step by step procedures for consults and also the available platforms. And I use infographics to make it more engaging and user friendly for mommies and daddies looking for a virtual method of healthcare.
Okay, because of the challenge of the pandemic regarding face-to-face consults, I opted to hold telemedicine or virtual consultation. Well, this is especially for my patients who are residing outside Baguio. So what I did is I initially made a Facebook page as a nephrologist, and this was separate from my personal page. No, so I actually posted there an infographic detailing how they could avail or how they could ask for online consultation. Um, Also, we texted or contacted my patients, and informed them that there is an option of online consultation via Facebook page. I chose Facebook because I believe that a lot of my patients have Facebook accounts. If they don't have an account, I believe that their children, their relatives have Facebook account. So I think it's more accessible to them. So that's what I did during that time. So um, of course, what we did is after they asked for a consult, and after giving them or letting them read the limitations, or after they consent or give informed consent, this is the time that we give a schedule for online consultation. And I actually let them choose the platform that they want, and I have noticed that a lot of them really choose Facebook Messenger because I think it's really easier for them. So with the challenges, well, actually there are a lot of challenges in telemedicine. One, of course, is the accessibility of some of my patients. We all know that not all have fast or good internet connections, and also there is this difficulty in doing virtual physical examination. And since majority of my patients are elderly, there is also this challenge that some of them or majority of them are not familiar with this technology. So actually another challenge is maintaining an electronic database. That was also a challenge for me. So I really had to be creative in telemedicine. I really had to have techniques in doing virtual physical examination, of course, with the cooperation of my patients. And I attended webinars that focused on online consultations, tips, the webinars which gave tips on how to do virtual physical examination. And I also downloaded platforms or programs that would assist in scheduling of my patients, that would assist in actual online consultations and dispensing of electronic prescriptions.
The one drawback, though, is that, well, this is a third world country, so the Wi-Fi signal and the cellular signal, especially in the mountains and in the coastal barangays, are not very good. So the communication would get cut midway. some of our elderly patients also are not tech savvy. And so we have had to ask their children or grandchildren to help them navigate the program. But on the whole, I think it has been very helpful, and I intend to keep it, especially for my not so mobile patients. And that's it, I think.
With the yung new technology, or hindi naman new technology, but with the onset of online or virtual consults, well, parang mas feeling ko mas lumiit yung mundo. Mas may chance na ako to serve yung mga areas na underserved. Wala masyadong specialista. As long as meron kang Wi-Fi, meron kang Facebook, meron kang Messenger, you can actually get access na or makapag-consulta ka na. So, parang wala nang reason not to get yourselves checked. Diba? And, yun lang, hindi masyadong pang malinaw yung concept ng consultation, online consultation hours to some of our patients. So I had to change my name on my personal account several times kasi nahanap nila ako doon. So pag nakikita nilang online ako, parang they feel na they can message me or anytime, no? So medyo parang nag-blur yung time. Although parang may kasalanan din ako doon kasi hindi ko na I-emphasize sa patients na ito lang yung online consultation hours. So, the rest, those are my personal time. Minsan kasi hindi ko din mapigilan di mag-reply. So, kasalanan ko din yun. But, all in all, I think this is now yung new normal, kumbaga. I think online consults will be with us forever na. It totally changed the way we do consults with our patients. So, I think mas malawak na yung reach natin. Mas marami tayong masaserve. So, yun for the positives. So, it's just a matter of managing your time. Especially defining your personal time and your clinic time. Time for your patients.
It's a challenge. It's a challenge, and it was a very difficult start, especially with all of these options available to us in terms of the online healthcare space. All of a sudden, it became a business when there was no business before. So, from no options and having zero experience in telemedicine, I think 1 year into the pandemic, I think every single physician is now probably somewhat of an expert in navigating some form of telehealth portal. So, it's hard because you have to spend. That's one. I mean, the clinics are already all set up. So, we had to get a new PC, get a nicer monitor, make sure your internet can handle everything. Then you still have to share your internet with your children and the rest of the family. So that's a challenge, telling them, don't use the internet or nagki-clinic ako. So that's always an interesting discussion, but now I think my kids get it. But in terms of the challenges, of course, it's always trying to replicate the human experience. How do you convey compassion and sympathy and empathy through a monitor? And I think I got around that by just spending more time. In clinic, I mean, I could blow through 20 patients, no sweat. Telemedicine, much more exhausting. So it takes time. It takes more time. Now I probably do less than half of that. But I'm online almost every day. So that's sort of how I make up for it. But that's really the biggest challenge, I think, is how do you replicate the experience that the patient has sitting in your clinic, looking at your face, you being able to tell them the difficult situation that they may be in. How do you explain the options for dialysis, the access options, the options for transplantation, the cost of everything? And these are not easy discussions to be had, especially if the patient has no idea of how you feel about things and whether or not you truly care. So it takes more time to be able to get that across. And I think that's really how I went about at least that challenge, which I found was probably the biggest challenge of all. Technically, we all have solutions for those already: faster internet, better computers. Um, you know, that solves the problem there. But it's the emotional component that's missing. How do you replace that? And I think the only way to do that is, unfortunately, for us, that means doing things a little bit slower and doing things a little bit more deliberately than the pace that we're actually used to.